Hi, my name is Jen Huffman. I'm a clinical liaison with Gateway Rehab Hospital. I'm here today with Danielle and Liz, and they are part of our therapy team here at Gateway. And today we're going to talk about our Parkinson's LSVT program. So can you tell me what the LSVT program is and who it's appropriate for?
Yeah, so LSVT stands for Lee Silverman Voice Treatment. Lee Silverman was a woman with Parkinson's disease who had voice impairments. So they created this program to help her improve her vocal loudness, which is the LSVT Loud program. And then there's also an LSVT Big program that Danielle will talk about. LSVT Loud is mainly for patients with Parkinson's, but it's also effective with other neurological diseases on a case-by-case basis. So the goal of it is generally to improve your vocal loudness so that people can hear you better and you can communicate better.
And the LSVT Big program was actually created from the Loud program, and it's targeting hypokinesia and bradykinesia, which is small and slow movements that happen with Parkinson's disease. And the focus of the exercises is to work on big movements to help with their balance, walking, and functional mobility.
Oh, okay. And how long typically does the program last? And how many days per week do they have to come for this?
For the Big and the Loud program, it's the same structure. So it's a 4-week program, and they come 4 days a week. Each session is 1 hour long, and in addition to coming into therapy, they're also performing home exercises. So on days that they're coming in for therapy, they're doing those home exercises just one other time a day, and then on days where they're not coming in for therapy, they're doing the home exercises twice a day. So it's a pretty intensive program.
Yeah, it sounds like it. What kind of research? Has there been any research to support this program?
Yeah, so LSVT, both the Loud and the Big programs have over 20 years of research. A lot of the research has been funded by the National Institutes of Health, and specifically for the LSVT Loud program, research shows that these results from the program last over 2 years after the treatment is completed. That's great.
Yeah, that's great.
The Big programs also had a lot of research performed, 20 plus years, and all of the studies have consistently shown that patients who go through the program have demonstrated improvements in their walking speed, trunk rotation, balance, and overall functional mobility. And another important thing that they have found is that the earlier a patient gets started in the program, the more effective the results are.
Okay. And what kind of exercises do they do?
So for the Big program, the structure of a typical exercise session is first they perform 7 maximal daily exercises, which of these exercises are the same for each patient. So they consist of 2 seated exercises that focus on posture and trunk rotation, and then 5 standing exercises that focus on forward stepping, lateral stepping, backward stepping, and then some trunk rotation and weight shifting. In addition, they do 5 functional tasks, and those tasks are more specific to the patient and what they have difficulty with. So it may be things like sit to stand, turning, backwards walking, writing, buttoning, and then also they perform 1 to 3 hierarchy tasks, which are more complex tasks that the patient has difficulty with. So things like getting in and out of bed, getting on and off the floor, getting in and out of the car, or whatever the patient whatever is important to the patient. They are also going to work on walking each session, and this may be with or without an assisted device depending on the patient's level of mobility. And at Gateway, we do have a U-Step walker, which is a walker designed for patients with Parkinson's disease.
And then for LSVT Loud, a typical session kind of follows the same protocol. So you're going to do some voice exercises, sustaining the sound ah at different pitches. Then you're going to go into 10 functional phrases similar to her functional mobility exercises. And these functional phrases are something that are specific to the patient. The patient and their family members pick these phrases, so that way the patient is encouraged to use their loud voice while saying these phrases at home and in their everyday life. It's more salient. And then after the functional phrases are completed, you go into the hierarchy tasks similar to the Big program. And these are just other verbal expression tasks that may be at the word level or the paragraph level or the conversation level to try to climb up that ladder to get them really using their loud voice in an everyday setting.
Okay. And so why would somebody choose the LSVT program over just regular therapy?
So for LSVT Loud, typical voice speech therapy doesn't address the voice in a manner that is needed for Parkinson's disease. So for Parkinson's disease, you need something that is repetitive, it's intensive, and it's simple. So as we go through the same program for 16 sessions, you see more changes because it's repetitive and it's intensive. And then the patient is encouraged to use their loud voice in everyday settings with a family member, so getting family involved with the lab program and the homework exercises and everything involved with the lab program gives you better results for patients with Parkinson's than typical voice therapy would.
Okay. And how do you get started? How does someone get started with this?
In order to get started, the patient just needs to get a prescription from their doctor. So for the big program, it would just read LSVT Big Evaluate and Treat or LSVT Loud Evaluate and Treat. And then they can just give us a call at our outpatient department, and the phone number is 859-426-2415, and we'll get them scheduled.
That sounds awesome. Thank you.
Welcome. Thanks for having us.